Well, Professor, if you are talking about arthritis as something that you're not likely to be able to avoid as you get older, what about the costs of treating these diseases?
Again, the cost depends on your diagnosis. For example, in osteoarthritis, the cost is usually quite affordable. Usually you take some painkillers, and you can take some supplements, as I mentioned, but then you must know which supplements to take, how long, how much. A lot of my patients actually say, oh, I take supplements, I take glucosamine. So I ask them how they take it. They say, oh, sometimes I take one tablet, sometimes I forget, and sometimes I don't take even 2 weeks. Now this sort of thing doesn't work. If you want to take supplements, do look at the label. Every supplement bottle comes with a label, and they will tell you how much to take. So you must follow the instructions on the label. And usually when you take supplements, for example, for osteoarthritis, you take it every day for about 6 months. If it doesn't work, it's not going to work on you. There's no point carrying on the treatment for 1 or 2 years. But you must take it regularly. Now for the other kinds of arthritis, again, depends on the diagnosis. Gout treatment is quite cheap. You just take some special treatment for gout, which will reduce the pain swelling, and you take a medication called allopurinol, which will reduce the uric acid in the level. Now allopurinol is quite cheap. Okay, now for rheumatoid arthritis, again, it depends on the stage of the disease. If early rheumatoid arthritis, it's quite simple to treat. It's not very costly. But if you come to a later stage, then a lot of this condition do not respond to the cheaper drugs. Then you have to go on to the more expensive drugs. Like I mentioned, biologic agents. Now, biologic agents is very expensive. It has to be given by injection and usually costs about $2,000 a month. The problem with biologic agents is you actually cannot stop. So you have to be prepared to spend $1,000 a month for at least 6 months to 1 year. And when your condition improves, then you can increase the duration of the time you give the medication. In that way, you save some money. But generally, biologic agents are very expensive. So the lesson to learn is, if you have rheumatoid arthritis, get it treated early, then you'll save a lot of money. If you come to the later stage, when you require biologic agents, it's going to be a very expensive affair.